Hello, thank you so much for joining me, Dr. Brown. I have a very special guest today, world sleep expert, and she was my personal coach when I had trouble with sleeping only 3 hours, especially during my grant writing time. And I had Dr. Brown helping me getting rest so that I could be efficient. And that was like the biggest productivity hack I underwent. And so I want her to share how sleep can affect your productivity and efficient, especially for people in academia. We are always in this work schedule. Let's introduce Dr. Brown. Can you please tell us more about yourself?
Yeah. Thank you so much, Dr. Gia. I am such a fan, and just all the work you're doing in this space is phenomenal. And the fact that you're doing it and prioritizing sleep really I'm just a fan. And like you said, I'm a sleep physician. I am the founder of RestfulSleepMD. And what I really do, what my passion is helping high achieving women prioritize sleep because that is our superpower. And so I work with women, I work with the professionals overall, as well as their children, to really prioritize sleep, because people just really underestimate how important sleep is. And I'm just really delighted to be here.
All right, thank you. So I'm going to ask a few questions so that my audience will learn from it. A lot of it is my personal questions that I had when I first started, and I'm sure all of you will learn from this. So the first question is, why is sleep so important for productivity?
Yeah, absolutely. So one thing I always say, I almost sound like a broken record. It's like sleep is not a luxury. Sleep is a biological requirement. So sleep is actually critical to life, as important as water, as food is. Sleep is also that important. And the same way, you probably wouldn't be your optimal self in performance if you're starved and dehydrated. Also, when you're sleep deprived, you will not be. Except sleep actually has so many other benefits, right? So when we look at it from top to bottom, in terms of our memory and our executive function and the ability for us to really optimize our cognitive performance, everything is around sleep. And even our physical health, in terms of our heart health, there's studies that have shown that increased risk of heart disease, hypertension, stroke, all sorts of things can happen when we don't sleep well. Our metabolism is off in terms of sugar, glucose tolerance, and insulin sensitivity. And so that can also lead to things like obesity, diabetes, and things like that. Now, when I circle back, I always have people just consider sleep. Think of it like if you have a clogged sink, right? If you have a sink that's clogged, what will you do? You'll clean it, right? And so the brain actually has a cleansing system. It's called the G lymphatic system. So it's like the lymphatic system we have in our bodies, except for the brain. And so what it does is it cleanses deposits, right? Waste products that are built up over the course of the day. And that happens during deep sleep. So when we don't sleep well, we're really losing that benefit. And so usually what I'll say is, imagine how you feel. Remember how you feel when you don't sleep well. You wake up with either that fog. Sometimes you seem like you're losing words. Sometimes it seems like you're just not as creative. And some of that really is because you've not exposed yourself or utilized that benefit that sleep produces.
So at night, when you're sleeping, that's when the cleansing happens. And if you don't sleep, all the gunk is in your brain. Okay, great. Thank you.
And the other piece also is with our memory, you're also taking things right from short-term to long-term memory. So that all happens during sleep. And also learning and consolidating skills that we learn is also happening during sleep. And I've actually looked at people who either had a skill they were meant to learn, they practiced, and then they compared them to groups who didn't practice but didn't go to sleep. The other one group practiced and then, say for instance, piano, and then went back to sleep. And then when they both came back to rehearse, the difference was clear. Those that had good sleep were able to replicate those skills much better than those that didn't.
That's really important because as we are writing, as we're learning our research, it takes time to read a paper. And then if you don't sleep, you're just forgetting it. And so you're wasting time. Now you're doing double work. So again, it's really important in terms of efficiency. So I think my audience typically are clinicians and academics. So they buy that it's important, but it's more like, oh, I still have trouble sleeping. What are the common sleeping issues among academics or clinicians?
Yeah, I would say that is so true. We don't typically practice what we preach as clinicians, as people in academia. We show all the studies, all the randomized trials about how this act or this behavior or this activity will benefit, yet we really don't participate in them as we should. I think the thing about sleep is, one thing I noticed that people struggle with is prioritizing it to start with. Really fully understanding that you're not just sleeping because the day is over and you're tired. Really understanding your why. How do you want to feel? And sometimes there's that missing connection. So that's one thing. So just that inability to prioritize it. And there's so many reasons why we don't. Sometimes this is because, one, we have too many obligations. We have too many things on our plate. We have nonstop like deadlines, grants, all those things. And even when we say, okay, you know what, after this, the next time I'm writing a grant, I'll be so proactive. I would have prepared so that I'm not stressed. I'm not waiting till 12 midnight when it's due. So
Yes.
it's all those things we just really, and then we get away with it because you're like, oh, you know what, I pushed it, I hustled, and it was fine. And so we don't feel that impact as much. And so sometimes, again, it's those obligations. It's too many things on our priority list, and then sleep just gets bumped. Sometimes, especially in the medical field, we feel like it's almost like saying that you rest and you sleep. It's like, why should you? It's almost like a badge of honor when you say you're sleep deprived and you work so hard, you only get 4 hours of sleep. And we wear that on our sleeves. And that's something that we do have to change the narrative about, because I remember it was like, you couldn't say it in public that you're getting 7 to 9 hours of sleep. Like, no, wow, that means you're not getting stuff done. Sometimes it's that narrative and what the culture has taught us. And while in training, we have the ACGME rules, we protect that 80-hour work week kind of thing. But then think about it as an attendee, nobody's paying attention to that. And so things just go haywire. And so really systems, the way the system is built, doesn't necessarily afford us the opportunity to get good sleep. And then there are other situations where there may be the opportunity. And that's why I always tell people 2 different things. And I experienced this myself during training, where it's not so much the opportunity. Sometimes the opportunity is there. Sometimes you're like, finally, I got it done. The kids are asleep. All things are done. I checked up everything on my to-do list. And then we get into bed and then the switch turns on. And then our minds are racing. And then we start to process, we start to catastrophize, we start to plan the next thing, we start to experience regrets or conflicts we experience. So sometimes it's us really with our minds racing and not really being able to shut down. And when you experience that over a long time, where you either have difficulties falling asleep, staying asleep, or you're waking up at a very unreasonable hour, then that's insomnia, right? So then it may have started with, okay, sleep deprivation. Now I've tried to optimize my sleep the best I can, and now I can't fall asleep. And sometimes insomnia is something that I see a lot because we work in a very stressful situation, right? You have constant, all these expectations, things that you're meant to do, papers you're meant to submit, the research you're meant to do, the mentoring and everything else, that it's just a lot.
Right. I think the last one really resonated with me because I remember during grant writing season, I fall asleep dreaming about writing. And then I wake up in cold sweat and I jump out to write the grant. And it's a vicious cycle, as you say, the non-switching off. And with that, do you have any advice for people on how to go from, okay, work, how to turn it off so that you can have a restful sleep for the next morning?
Yeah, I think one of the things you talked about, even at the beginning, one of the things sleep helps us do is that's really a lot of clarity. We get a lot of clarity. A lot of our creativity happens after we sleep, which is why if you, for instance, find that you're reading the same sentence and it's been the 5th time, and it's late at night, it's time to put it away. So first of all, really knowing yourself, knowing when it's time to just stop pushing, because it's a waste. I would rather you go to sleep at an appropriate time. And even if you wake up a little bit early to then finish up the work, I would rather do that rather than you burn the candle on both ends. So I was just going to start with that. That being said, one of the most common reasons why people in academia and clinicians, people in medicine don't get enough sleep is we usually don't have a buffer transition zone. Not just get enough sleep in terms of the mind racing. So we don't have a buffer zone, right? We've gone all day. We've ignored our thoughts. We've ignored our emotions. We've ignored the bathroom, right? You're just going.
Yes. Yeah, bathroom.
Barely have time to eat. And then it's time to sleep. And then you try to crash. But then what happens is for the very first time in the last 24 hours, your mind, your feelings, your emotions suddenly have your attention. And they're like, huh, finally, and then you're like, oh my gosh, I'm exhausted. Why can't I sleep? But if you have a buffer zone, which, call it sleep routine, transition period, wind down, that really takes you from the day is over, I've done the best I can today, and it transitions you to sleep. So if you can create that, and it doesn't have to be anything fancy, right? We have most of us have bedtime routines for our kids, right? They read a book, they take a bath, we sing a song, we do a hug, we do the song and dance, and then we stop. We need it too. Because what you're doing with that routine is you're cueing your body to start to wind down. You're turning down bright lights in the home. You're powering down the devices. You're putting your phone on do not disturb, except maybe for VIP people. But spending time going over the day, like, how was this day? What did I do right? I love gratitude journaling, right? What went well today? Because many times what we tend to continue to have in our minds are things that didn't go well. That rejection that for that paper you submitted, or that patient that the family got upset with you, something else, a decision you made, a conflict. We don't think about the amazing patients we took care of. We don't think about the amazing trainees we mentor, right? So we focus on those negatives. But when you can incorporate some period of reflection as part of your wind down, I think that really helps you then say, okay, I am phenomenal. I did the best I could today. Or, well, today just happened that I have no clue what happened, but tomorrow is another day. These are things within my control. These are things that are out of my control. This is a plan for questions that I may have. So that way you're essentially almost doing a mind dump. And I think that is critical. We miss that. And so it's hard for our minds to shut down.
Okay. So many great tips here. Have a buffer zone for you to unload all the emotion that you haven't processed. Okay. Second is write it down and start to do wind down, which is no more blue light. Is that right? More blue light, even a house light, start turning it down so that and finally, journaling is a good way to process not only the negative, but start thinking about the positive so you can have a better sleep. Wonderful.
Yeah. I was going to add too, as part of that, a lot of the mind work is what I really try to get people to pay attention to. The other things that matter, that helps you, is things like hygiene, right? So brush your teeth, having a bath or a shower is so helpful. One is because it helps drop your core body temperature. So I would also include that as part of your routine. Now that routine, I know a lot of what I focused on was more of the sort of offloading your mind, but take care of your body as well. Take a bath. Once you do that, maybe read a book. From there, do a little journal and some gratitude, do the mind dump, and that really will get your body ready for sleep. And it can be anywhere from 20 to 30 minutes or even less. It doesn't have to be anything.
Yeah. So one thing I noticed too, right now we are deep into the talk of sleep. And what I realize is people don't realize they actually have sleep issue. Can you talk about more like the subtle signs that you should start thinking about when, if you have these signs, then you think, oh, maybe I have sleep issues?
Yeah, absolutely. So when I think of sleep issues, right, in adults, in children, I always put them in three main sort of categories or buckets. So the first is essentially more of the medical sleep problems, right? So things like sleep apnea, which is actually more common than we think, especially even with women, right? Sleep apnea, and of course, those are things like the snoring, the excessive sleepiness, the unrefreshing sleep, the nodding off at the wheel during the day, needing caffeine to jumpstart and get you through the day, those kind of things. And then we have things like restless leg syndrome, where you may have just that discomfort in your legs, or you're tossing and turning at night because your legs seem to have a life of their own. That also fragments your sleep. We have other disorders like delayed sleep phase syndrome, where your body naturally just prefers a later bedtime, but then you have to wake up super early in the morning, so you're just chronically exhausted and sleep deprived. So those are a few of those. And then narcolepsy, that's a very serious one, where you just have this uncontrollable urge to sleep. So if you do have any of those, if you have any of those symptoms, super excessive daytime sleepiness despite sleeping well at night, in the sense of you got enough hours, if you have loud snoring, or your partner says you have loud snoring, or you're tossing and turning and really can't seem to down to sleep, or you're having this uncontrollable urge to sleep during the day, usually it's also accompanied by symptoms like loss of tone, what we call cataplexy, things like that's narcolepsy. So if you have any of those, then you really need to get that checked out. Right. So that's sort of the medical bucket. There are other things. If you're on medications that make you pee a lot at night or something, then of course that goes onto that bucket. So that's the first bucket. The second bucket, I would say, are more of those behavioral things. So it's the phone, it's the excessive blue light exposure, the social media, the things like that then make it hard for us to sleep. Or if we're drinking caffeine because we're so tired, and so we need caffeine, and then our bodies cannot just wind down. Because caffeine is a great drug. It's a drug, it's a stimulant, right? But it has such a long half-life. So if you drink caffeine because you were exhausted in the middle of the day, or you drank your caffeine at about 4 p.m., or you drank with dinner, then it's really, the half-life is so long. By the time you're ready for bed, you still have it in your system, and it really deprives you of restorative sleep. Other things like if you're drinking alcohol before bed, or eating super heavy meals before bed. So some of those habits really, or you're taking like super long naps, and we could talk about naps during the day, then you're like, but I can't sleep at night. It's probably the nap. So those are the behavioral bucket. And then the third is, what are the things that are present during the day that also just presents at night? It just has its own presentation at night. So if you have anxiety, depression, or mood disorder, or you're going through chronic stress or things like that. So those things are present during the day. You feel high strung, you feel overwhelmed, you feel stressed, you feel like you're just on the go. And at night, well, it's there. It also has its presentations like ADHD and things like that. We see that as well. So the three sort of buckets. So when people really say I have sleep issues, I really help take a deep dive, like where do we fit? A lot of times it's all three. And that really helps us then come up with an individualized plan. Say, okay, this is what we need to do. This is what we don't need to do. For instance, where do kids come? Kids are sleep disruptors too, right? So really taking a deep dive will help us know beyond sleep hygiene, these are the things that are going on.
Let's talk about the kids. The kids is one of the biggest disruptors in sleep because they come in multiple times. Can you tell us more about how do we stop that? And are we perpetuating this? Because when I was working with you, it seemed like that was one of the biggest problems. And as a student, I'm happy to report to you, my daughter no longer comes over. She falls asleep by herself. So I am a full graduate now, but I would love for you to tell your audience, if you have kids sleep issue, we may be the one perpetuating the problem. And how do you just train your kids so that both of us get
exactly. First of all, I'm so proud to hear just your journey. This is awesome. And that's the thing. Once we can do the work, I mean, it seems like work, but once we can commit to it, it really helps them long term, right? So when we come to the kids, I always also, again, we go back to those three buckets. I want to make sure there's not a medical problem. Because if you have a child who has reflux, for instance, right? Or they have pain, an ear infection, or you wouldn't just leave them to cry or just say, listen, go back to your room. I don't know. I'll see you in the morning. You want to address that. So we always, once I'm doing my intake, make sure there's no sleep problems we're concerned about. So that's the first bucket. And then the second, really, we do see a lot more of the behavioral problems. And that's very common. It's either difficulties falling asleep because they want their mommy or their daddy or a parent to be with them. And so we call that a sleep association or a sleep crutch. And it's not just for the babies, right? You may have heard of, oh, my baby needs me to rock them to sleep, or I need to nurse my baby to sleep. Even for older kids, some may say, mommy, can you rub my back until I fall asleep? Can I rub your arm? Or so that's what we call a crutch or a sleep association. And it's important we try to rate that. What I usually will say is, even though most times your child will come and wake up multiple times and come to your room at night, we hardly ever talk about the night wake-ins. We don't. I will always take you back to what's happening at the beginning of the night. That is where we usually will pay most, I would say about 90% of our attention. What is going on? Even if your child is waking up 6 times, let's go back to the beginning of the night. The reason why I say that is your child waking up, even you waking up is completely normal. Everybody wakes up because we go through different cycles of sleep. We go through light sleep, deep sleep. That's like your non-REM sleep, which is broken into light sleep and deep sleep. And then we go into REM sleep, which is that dream sleep, right? And then we sort of cycle through and then we do it again. So that's how we cycle through over the course of the night. And we have the sleep cycles, maybe about 5 or so over the course of the night. So as you're going from one cycle to the other, you have what you call an arousal. So it's completely normal and you go back to sleep. But most times we don't remember that. The conditions were the same. When you went to bed, you had your blanket, you had your pillow, you had your sleep mask, whatever it was. But if any one of those three fell off over the course of the night, and then you have that normal arousal, then you wake up fully because you're like, wait, when I went to sleep, my mask was on, or my pillow was on, or my blanket. And so you need to restore that condition to fall back asleep. The same thing with your kids. When they went to sleep, you were there. You were rocking them or rubbing their back, or they were rubbing your arm, or you were just present in the room. So they wake up like they would normally, but they're like, wait, the last time I was awake, my parent was there. So they need you. Hence, they come in again as they go through every sleep cycle. It's nope, I need you.
Yes.
So that's why really we then just work on the beginning of the night. And there's so many ways to go about that. But again, the focus is always at the beginning of the night. Let's find a way to get them to fall asleep independently at the beginning of the night. So they remember, I am capable, I am confident, I could do this by myself. And then when they wake up like they would in the middle of the night, they're like, well, I fell asleep on my own. I'm just going to do it again. And usually those night wakings then go away.
I remember not even thinking that my kids' sleep was affecting me. So I think just this portion of the interview itself, if somebody here learns about this, like work on your kids' sleep is going to help you sleep. It's such a game changer. And now that knowing before and after, she no longer comes and wake me up 4 or 5 times a night. Just even when I get a 4 or 5 hour is better than an 8 hour with that 5 interruption. That is how different it feels. And so I want to encourage everybody, if you start noticing that if your child is interrupting, especially the bigger kids, you're nursing, that's a different story. This kids 5, 6, 7, 8, 9 still doing that means, so let's shift gear a little bit. We need to work on it. Yeah. And talk about naps. So before, I heard that because we were sleep deprived all the time, we should catch up with naps. If not, it's going to be really bad for the heart. But when you nap too much, we can't sleep. So it becomes a vicious cycle. Is there a good balance between napping and in terms of recovering and not getting into this vicious cycle?
Yeah, no, that's a great question. So the way I usually will help people see it is this system. We have two ways or two mechanisms or two processes that regulate our sleep. One is our circadian rhythm, and really that essentially is aligned with our 24-hour cycle, right? So that's our internal clock, right? At the beginning, in the morning, there's light, right? That suppresses melatonin. We go through our day. We have a little bit of a dip in our circadian rhythm. And so we have some moments of drowsiness, maybe around noon or so. And then over the course of the day, we start to really get to the nighttime and then we go to sleep. And then that's one process. The second process is our homeostatic drive. And that's like think of it like your sleep drive or your sleep pressure. Some people call it process S. And so what that means is the longer you're awake, the more your pressure builds up. Think of it like your appetite, right? If you just woke up in the morning, you don't have any appetite for sleep if you slept well, right? And so you get through the day, your sleep pressure builds up, and then at night, coupled with your circadian rhythm trending down because you start to feel sleepy, then you fall asleep and you repeat it again. But anything that disrupts that sleep drive is going to make it such that you may be less sleepy. So if you take a nap, I am a lover of naps. I think naps are great. I think they should be part of self-care. I think we should all have siesta. But my recommendation is keeping it short and sweet because of that reason. Because if you have had a long nap, remember that pressure, then you don't have enough time left in the day to build up enough of a sleep drive to be able to fall asleep. And so then you're tossing and turning. But if you take a nap I would say usually I would limit it to cap it to about 20 or 30 minutes. And if you take it earlier in the day, depending on if you're going to bed at say 10 p.m., for instance, then you probably don't want to take a nap after 1 or 2 p.m. because again, you want time to build that pressure and you don't want to dissipate all that pressure through your nap. And because that's what causes the cycle, right? If you dissipate the pressure with a super long nap, you hardly have enough. So at nighttime, when you should be sleeping, you're tossing and turning, and then you eventually fall asleep late at night, and then you're exhausted during the day, and then you take a nap, and then we're back there again. And
what's
also,
the hour again? How many hours again you need to build the?
It's not like a magic number. I just find what works for you. For me personally, what I recommend is really limiting any naps after about 2 p.m.
Okay.
Yeah. And then you also always, with everything, come back to your why. So if you have insomnia, if you're someone that no matter how exhausted, you're not able to fall asleep, you have your mind racing, or you're waking up for prolonged periods in the middle of the night and things like that, then you probably should not take a nap because we want to use everything we've got. We really need to build up your sleep pressure. So if you have insomnia, then I would say do not take a nap. Let's treat your insomnia. But if you're someone who's just like chronically sleep deprived, you're a shift worker, things like that, where you're just not able to, and then catch up on a little bit of sleep here and there, I think is good.
You were talking about shift worker. I just suddenly thought of one very important question because we have residents who are doing night floats. I just came back from a conference, and even though there was no time difference, for some, it was a 3-hour time difference, and we just had the daylight saving. Tell us more about how do you try to adjust quickly with all these shifts?
I know, that's just so hard. So 3 different things that you just talked about. One is travel. So with jet lag, right? So what we talk about is you're traveling across time zones, and usually it takes about a day or so to recover per time zone traveled. And depending on where you're going, I think there are 2 things that you really need to take advantage of. One is light, and the second is the meal times. And the reason why is because our circadian rhythm has several cues. One of them is light, and the other one is meal. So essentially what you're going to try to do is, depending on how long you're going for, if you're just going for 2 or 3 days, you may just need to hang in there and then come back. But if you're traveling for about a week or so, then trying to adjust as quickly as possible to the new time zone you're going to is helpful. There is actually a very good website. I forget the name right now, but I think it's called like Time Traveler or Time Zone Traveler. I'll look it up and then I'll put it in the
link. Yes,
because what it does is you literally, depending on where you're traveling to, it really helps you. You put in what time zone you're in, what time zone you're going, and then it gives you recommendations about what you need to do in preparation. So it just takes the map off, because sometimes what I would recommend is, especially if you're going for a while, you may want to start to shift your, say for instance, you're going east also. You may need to shift your bedtime a little bit later, a little bit later, a little bit later. So that's something that, if you're going for a conference for 2 days, it's just a lot more trouble than it's. What I would just recommend is that try to adjust as soon as possible. Give yourself grace. Use light to your best advantage, and then you come back home and then you readjust. With shift work, there's a few things. It's hard, right? Depending on what type of shift. Usually for night shift, that's the hardest. Always just say that 2 different things or 3 different things you want to pay attention to. That's what to do before the shift, what you want to do during the shift, and then what to do after the shift to optimize your sleep. So before the shift, this is where a good generous nap is okay. Before you go on a shift, because you want to optimize your alertness. Remember, now you're going to be working completely opposite to your circadian rhythm, right? Your body is thinking you should be asleep, yet you're awake in the ER or wherever your shift is. So you want to try and take a nap. You want to do caffeine. That's where I recommend caffeine. So take a nap, take some caffeine to promote alertness. And then when you go for your shift, you want to expose yourself to as much light as possible. So essentially, we're countering what we typically would do at night when we're supposed to be sleeping, right? So that will help promote alertness, because we need you at your best. We don't want you drowsy as you're typing notes or seeing patients, right? So we want to do that. Close to the second half of your shift, you want to start to cut back on caffeine. You definitely don't want to eat anything too heavy or anything like that. And then you want to start to strategically avoid very bright light. That's at the second half of your shift, because we're now trying to wind down. And now when you're done with your shift, tell everybody bye-bye, sign off, get rid of that beeper or whatever you need to do. Get the darkest sunglasses, because you want to avoid exposure to light. And go home. Don't go do groceries. Don't go finish up a paper. Don't go do anything else. Just go straight home. Put a do not disturb sign on the door. Take a shower, because you want to get the grime from the ER or whatever off your body. And plus, you want to have a mini routine, right? A mini bedtime routine, right? And then get in a room that's as dark as possible, cool temperature, to try to sleep, get as much sleep as possible. It won't be like your full 8 hours of sleep, most likely, but then you want to get as much sleep as possible. And so really strategic napping, strategic caffeine, really trying to protect your sleep as much as possible post-call is going to be very important for function.
Wow, like if I knew that as a resident, it would have made me switch so much faster. So I want to quickly do a recap. It seems like in order to adjust quickly, make use of light and mealtime.
Exactly. And in some situations, you can use melatonin very often. I don't typically recommend, just if you have insomnia, you should not as a week. It's not like a sedative or anything like that. But in situations like that, for shift work, for jet lag, using melatonin to help you to fall asleep is also something that I would say you can consider using if you feel the need to.
Speaking of which, I do know that some residents, when I try to switch, I use Benadryl to sleep during the day. Is that recommended, or does it like mess up with your sleep even more?
Yeah, there's so many sleep aids. So many. A lot of them are over the counter. Benadryl or diphenhydramine is very common. Tylenol PM, all this. Melatonin is also one of them. Root, some people will swear by, and all that stuff. I think the question is why? What do we need it for? I would say, if you're going to use some of this, and this is, my opinion, because I know the struggle is real, and it's easy for us to say, yes, don't do this, don't do that, but you're there and you want to be your best self. If you need this short term, I would say it's okay. I think you do have to be careful, because a lot of those sleep aids don't mimic natural sleep. Some of them will swear that they do, but they don't. Histamines, things like that, leaves you with this dry mouth, leaves you super drowsy, super groggy, puts you at risk of falls. So you have to be really aware of it. So if you have more of crisis, like I need something, I think short term from here to there, it's fine. You're a human. It's fine to use it. But then come back to your why. If you start to realize, I need this to be able to get any type of sleep, I need this to be able to put myself down. It's like alcohol. That's also commonly used as well. Then you really need to come back and say, okay, what is going on here? Why do I need this? And so it's important. I prefer some of this natural approach, because what's the long-term plan? Like, are we always going to use Benadryl, right? Are there ways we can optimize our environment, make sure we're dropping our core body temperature so we can really get that melatonin out as much as possible? Make sure that we're building boundaries, make sure we're doing all those things. And when we do those seeming behavioral strategies, give us a better bang for our buck, so to speak.
All right, that is so awesome. Thank you so much, Dr. Brown. And before I end, I want to give a quick disclosure. This is an interview, not pure medical advice for you. Both of us are doctors, but we are not your doctor. So if you have any sleep issue, please go back to your own doctor. All right. Once again, thank you so much, Dr. Brown, for all of your wisdom. And I am sure anybody who watches this is going to get a much more restful sleep and also increase productivity and efficiency. Tell us how we can find you or anybody can find you and work with you.
Yeah, absolutely. Thank you so much for having me, Dr. G. And I agree with you. I think you can use sleep as your secret weapon to really optimize. You've done it all. You've worked hard, you've studied, you've trained for so many years, and you are on a mission to do so much. If you can just harness sleep, I think it's going to be so much better. In terms of where to find me and if you want to work with me, my website is RestfulSleepMD.com, and I do offer coaching. Like you said, it was great to just close this loop. I'm so thrilled months ago that we worked together. But yes, so I do help you achieve really optimal sleep. And again, we look again at those sleep disruptors, be it kids, be it your mind racing, whatever it is, and then we really address it. My website is the best place to find me. I also hang out on Instagram as well as on LinkedIn. And also, I didn't go as much into detail about sleep hygiene because I feel a lot of times you'll Google it, you'll find something on that. And I think that helps, but there's a lot more going on. But if you go to my website and actually go on there, there is a checklist of really evidence-based strategies to get restful sleep. So not just the 100 things that you'll see that will overwhelm you, but like the critical few that would help you start sleeping well tonight. So head on to my website to get that.
As Dr. Brown says, it's evidence-based by a sleep expert doctor, not just some guru from online, okay? I'll put a link in the description section. Once again, thank you so much. I hope you have a good day. Take care.
Thank you.
Bye.